Why is SUV important in lymphoma PET scan results? Imagine trying to find a tiny spark in a dark room. That's kind of what a PET scan does when looking for lymphoma cells in the body. It uses a special radioactive sugar called fluorodeoxyglucose, or FDG, which is like a tracer that highlights areas where cells are using a lot of energy. Cancer cells, including those in lymphoma, tend to use more glucose than normal cells because they grow and divide quickly. When FDG is injected into the body, these active cancer cells absorb more of it, making them stand out as bright spots on the scan. Now, the standardized uptake value, or SUV, is a number that helps doctors understand how much FDG has been taken up by a particular area. Think of it as a way to measure how hot or active a spot is. The higher the SUV, the more glucose the cells are using, which often indicates more aggressive or fast-growing lymphoma. For example, aggressive lymphomas like diffuse large B-cell lymphoma usually have higher SUVs because their cells are very active. On the other hand, slower growing or indolent lymphomas tend to have lower SUVs, which can help doctors tell different types apart. SUV is also really useful when it comes to seeing if the lymphoma has changed or transformed into a more aggressive form. If a previously slow-growing lymphoma suddenly shows a higher SUV in a certain area, it might mean the disease is becoming more aggressive. This can prompt doctors to do a targeted biopsy of that spot to get more information. They often choose the area with the highest SUV because it's most likely to contain the transformed or active cancer cells. Beyond diagnosis, SUV helps in staging the disease. It shows how far the lymphoma has spread in the body. A high SUV before treatment might suggest a more aggressive disease, while a decrease in SUV after treatment can indicate that the therapy is working well. But it's important to remember that SUV isn't the only piece of the puzzle. Doctors also look at other scan results, biopsy findings, and the patient's symptoms to get a complete picture. There are some limitations to SUV. Not all lymphoma types absorb FDG equally, so some aggressive lymphomas might have lower SUVs. Technical factors, like how the scan is performed or how the SUV is calculated, can also influence the results. That's why experienced medical professionals interpret PET scans carefully, considering all the details of each patient's situation. In summary, SUV is a valuable tool in lymphoma PET scans because it provides a measurable way to see how active the disease is. It helps guide biopsies, detects changes in the disease's behavior, and assists in staging and monitoring treatment. But it's just one part of the overall assessment. Always discuss your scan results with your healthcare team to understand what they mean for your specific case. Remember, every person's experience with lymphoma is unique, and medical decisions should always be personalized and based on comprehensive information.